a law enforcement perspective as well from our first responders. So this is a way that we can really have a big impact on all of those areas.
Governor, personal protective equipment, do you have numbers on how much Iowa needs or has requested from the federal government? And you said there was going to be a shipment coming maybe Monday or Tuesday. What's the timeline for delivery of some of that?
Well, so Monday or Tuesday, I think getting. I don't know some of the times that you're putting.
Governor, are there any plans
in the room before we move to the conference line?
Are there any plans to expand Iowa hotels and dorms into emergency hospitals if need be?
So, this is Director Flynn with Homeland Security Emergency and Management.
The Army Corps of Engineers has a mission from FEMA to assist states with converting facilities or building facilities as needed. They have reached out to us to ensure that they have valid contact information, and if that becomes necessary, we will work with them on that effort.
Thank you.
So that's the procedure that we take, that if there is a request like that, it's missioned through the Web EOC, and that's identified a task to somebody, and then they start doing the background so that we're ready to go should that happen, and that is in place.
Channel 13, go ahead and ask your question.
Governor, you keep saying that you're not considering a shelter in place, but you also keep asking Iowans to do their part, stay home, self-isolate, make sure you have social distancing. But wouldn't it be easier to mandate a shelter in place just to make sure that people are actually following those guidelines?
No, because I think we can manage it if Iowans will do what I'm asking them to do. We have a lot of essential services. We have a supply chain. We have a healthcare system that we need to stand up. And so we need to make sure that we have a workforce that's able to meet those needs. And if people do their part, if they are sick and they stay home for the incubation period, if they have a fever, a cough, respiratory issues, if they will pick up the phone and call their doctor, they will walk through an assessment with them. They will determine whether maybe they need to take a test for the flu, and then decide if maybe that's why they're ill. And if that's not the case, then maybe they would move to a test for the COVID-19. So those are steps that individuals can take to help us mitigate and manage and hopefully, as I've said over and over, bend the curve and prevent crashing our healthcare system, for lack of a better word. And so at this point, we're going to continue to reevaluate every day. We'll sit down with the Department of Public Health. We'll look at the CDC guidelines. We'll look at what's happening in other states, and we'll evaluate what we're seeing in the state of Iowa and where the hotspots are, and we'll make that decision going forward. But right now, we're not at the place where we're ready to implement that order.
KCCI, next question's yours.
Governor, we heard Director Garcia mention what they're doing at child care centers to keep them safe and protected. But what about for employees at state agencies who have to interact with the public? What's kind of being done to protect them?
Talks Insurance has a lot of
I think your question is, tell me if I caught everything. It's a little hard to hear you on the microphone, but what's being done for employees who still have to be on the front lines. So we have the largest presence of that. Director Skinner at DOC has the next largest presence of frontline staff. We are scanning temperatures just like we're doing at child care facilities. We are making sure that all of that is happening at shift change. For our social workers who interact with children in need of assistance and go into families' homes, we're calling ahead of time, or if we can't call ahead of time because it's an emergency situation, we are equipping them at the door to assess whether there's anyone who's ill in the house. We are also have an order in with the Department of Corrections to equip our social workers and as well as child care centers with hand sanitizer that can be in their car so they can easily distance during their work and then get back in their car, and since they may not have a space to wash their hands. There's a number of other efforts, but those are highlights.
Next question is Iowa Capitol Dispatch, Kathy Obradovich.
Thanks for taking our questions, Governor. This is for the small business owners out there who are deciding whether to apply for the disaster assistance that your office announced was available yesterday. Some business owners are wondering if they apply for that assistance now, if that will make them ineligible for any congressional relief that may be coming. Just want to get your best advice to those small business owners.
Yeah, oh, that's a really good question, Kathy. Thank you for asking that. So right now, we'll be standing that application up on Tuesday, and at the press conference tomorrow, we're going to have Director Durham and Director Paulson here to walk through some of the specifics of that. So this is timely. Hopefully by tomorrow, when we do the overview at our press conference tomorrow, we can have the answer to that question. I don't know the answer to that right now, but that's a really good question, and I will check on that and make sure that that's not a problem.
We're gonna do 2 more questions. The second to last question is Beth with KCRG.
Hi, Governor. I have a question. You know, you really have a 360-degree view as the executive of our state, and as you look at projections from various models on the spread of this virus, you know, I just was looking at one from Stanford University Research Center, and it shows just on an estimation of the number of hospital beds here in Iowa, we could potentially run out of beds even with the ramp up. And I know most or all hospitals really are ramping up right now and have been for the past month. We could potentially run out of beds by this projection by mid-May if you don't implement a shelter in place like our neighbor Illinois has within the next week or so. Are you seeing projections like that?
I'm going to have Sarah from the Department of Public Health address some of these, but you know, the numbers are changing every hour when it comes to the number of hospital beds, but the majority of the positive cases that we had today were mildly ill. And so if we too continue to take the precautions that we put in place in the next week or two, we're going to see if the things that we've implemented have really bent the curve like we anticipate that happening, which will help us really mitigate and strategically use our resources in the most effective manner, and that would include beds as well. So a big part of managing the beds is also making sure that we have the healthcare professionals to stand up the hospitals. And so again, if we take the precautions that we're asking Iowans to take and we mitigate the usage there, then we can hopefully spread that out over time. Sarah, do you want to address that a little bit more?
Thank you, Governor. And what I would say about that is that we do continue every day to watch what's happening in other states. We pay attention to the mitigation strategies that are being used in other states. We pay attention to national models that are developed, and we're also developing our own models. So we are very much keeping an eye on the data and what's happening and where our cases are occurring. We will continue to do that sort of evaluation and continue to provide the best guidance we can to the governor as she makes decisions in the days and weeks to come.
And the last question will go to Aaron Murphy with Lee News.
Thanks, Governor. I was just wondering, of all the data that we're tracking right now, are we tracking the number of people who are hospitalized, and do we know how many of the 90 cases have recovered?
I don't know the recovery piece, so I don't know the recovery piece.
The Department of Public Health does have that information, but I don't have it with me right now to be able to answer your question presently. But that is information that we are closely tracking. We work with our local public health partners in each of our 99 counties to check in on our confirmed cases in each of those counties. And so that information is available to us. I just don't have it in my hand right now to be able to provide that to you today.
I just want to close out the press conference again by just a heartfelt plea to Iowans to be responsible and help be a part of the solution. And that is, if you're not feeling well or you're sick, please stay home. And if you've got a loved one or a child that's sick, keep them at home as well. And if we all do that, we will get through this, and we will bend the curve, and we will help from shutting down our healthcare system. So thanks for all that you're doing, and just encourage you to play a role in helping protect the lives and the health of all Iowans. Thank you.